The most important thing for the health of a community is to have healthy mothers.
I would say this: nothing makes us happier, the Jewish Healthcare Foundation, than a room full of health activists. So this is a very happy moment.
And I also want to extend my welcome to all of you and thank you for attending today's symposium and for being part of this important conversation and for taking action.
I just want to emphasize from the outset, maternal mortality is not just about statistics. Each case is a tragedy.
So we were taking statistics that it was investigative, so we did find and unearth statistics that hadn't really emerged, but we were taking this material and using it as a layer of a really, really important story, and hopefully a layer that will help other people, including political people, and they have already been doing, but proceed in states and localities and in the United States government, in the Senate, with various legislation to come at this and try and work through some solutions, money as well. But mostly we were trying to get at who they were, who these women were, and you know, in a way, why we should care. I mean, other than the general sense of these are all tragedies. So we were speaking of Lauren Blumstein, who died in New Jersey. Her husband was a doctor. She was a neonatal nurse. She died in her own hospital.
There has to be a way to figure out how all of us can work together and collaborate to have the right person in the right place at the right time. And I personally believe we have to mainstream midwives and doulas into American healthcare. We have to do something about implicit bias and racism that's embedded in healthcare in our country.
As we know, this is another area where it's possible to get really overcome by the grim statistics. I always remember what someone once told me, that statistics are human beings with the tears washed away. And as we think about the maternal mortality statistics and the infant mortality statistics, as we heard earlier, it is a tale of tears washed away, rendered in dry statistics, but really involving the most tragic stories of human beings.
Extreme preterm birth, which means a baby born before the end of their mom's second trimester, is really what's killing the vast majority of our kids, and it's responsible for the vast majority of racial disparity as well. So what did we do? We designed for and with specific real people. We found and delivered measurable results for every woman in a geographic place. We assigned a nurse case manager and a community health worker to every single one of these moms. We connected the work in the medical settings to the work in the community and vice versa. And we reinforce the stakeholders with place-based motivation and data about impact. So what would happen if I personally, not you theoretically, me, what would happen if I gave equal value to that doctorate degree in the room and that mom with lived experience? What if I gave equal value to thoughtful data, which we need, but also with community voice? What if I gave equal value to teaching and learning? And finally, I think the very core of this, and something I wrestle with every day, am I truly doing this? What would happen if I gave equal value to my life and yours? That's at the core of this issue.
A mother is central to the health, well-being, and development of a child and future generations. We know what needs to be done and also have what it takes to save lives of mothers and babies. We need more intentional leaders and committed leaders to prioritize and address maternal and infant health. And I commend you all for leading the way.
So what really I think is the magic is bringing the team together with a common goal or a shared purpose. Now, it's well admitted, and that's one of the reasons why we're talking about this today, changing the payment model creates a sense of urgency, builds a burning platform, if you will, to create that shared purpose. But what really gets the stuff done is actually the team coming together and having a shared purpose around they want to take care of the patient. They want to make sure they do the right thing every time. And then we track that and actually create it's almost a social norm that doing the right thing is what everybody wants to do. And you don't want to be the person that, didn't do the right thing or didn't contribute to that, because we're tracking that all along.
So, to my mind, the real secret here to this initiative is it takes the physician out of the equation for most normal obstetric care. Most patients, if we're being completely frank, do not need an obstetrician to do their delivery. And what we found with the last 7 years of our pathways and metrics is physicians are very hard to get to adhere to pathways unless you specifically measure it, whereas midwives and other APPs and community health providers are very happy to have pathways.
%32% of Black women are constantly, every day, stressed by the fear of violence against their families. And this is, now mind you, we had 50% people who planned community births and 50% of people who planned hospital births. So we can really say that. I know that's not the population. The population is less than 2% community birth. But if in our study we're showing this, what do you think is happening elsewhere?
While there is growing recognition in this country that women-centered care is important, oftentimes you hear people say we need to empower women in order to improve birth experiences and outcomes. I disagree with that statement. We don't need to empower women. What we need to do is stop taking away their power, and we need to listen to them.
There are other issues out there that, as women and related to women's health, that we need to have this kind of teamwork, the sense of empowerment. We need to be working together, whether you're a researcher or a provider, any kind of practitioner, policymaker. Those of us who care a lot about making things better need to share ideas, and then we have to act on them. I like marching. I held the placard, it said I've been doing this, for 50 years, which is actually true. But it's got to be more than marching. We got to get busy now. There's some policy changes we need and practice changes, and we won't get them if we don't ask for them.